Compulsory jabs for NHS staff. Why?
Because, first of all, let me just thank the NHS and care staff for the amazing work they do, but especially those that have already chosen to take that vaccine. And they've done that not only to protect themselves and their colleagues, but most of all, they've taken it to protect their patients. And that's why, that's really at the heart of this. This is about patient safety. We know that the vaccines work. We also know that patients in hospital, in care, these are some of the most vulnerable people in our society. And if they are exposed to COVID, it could be fatal. And I think it's our duty to make sure that they are as safe as they can be. And that's why I announced this yesterday, so that from April next year, that if you work in NHS or care, you will be required to be vaccinated. And I want this to be a positive decision for everyone and to work with them. There will be absolutely no scapegoating, no singling out, no shaming, but working with colleagues to support them in every way that we can to help them make this positive decision so they can protect themselves, their colleagues, and most of all, their patients.
Yeah, but should they lose their job if they don't want to?
I don't want to see anyone lose their job. I don't want to see anyone have to walk away from their job. But I think that what we all do want to see, we want to see our hospitals, people providing care, whether it's in your home or in our care home, and we want those patients, those people to be as safe as possible. And now with what we know about this horrid virus, and but also the fact that the vaccines work, I just do think it is important to be doing everything we can. Because also what I don't want to see, most of all, what I don't want to see is someone being exposed to, that's vulnerable, being exposed to COVID when it could have been prevented, and perhaps they might even die from that, and I think that would be totally unacceptable.
So if you've been double jabbed, then you can't pass on the virus?
No, if you've been double jabbed, then you're less likely to be infected. Of course, you can still get infected, but you're less likely to, and we know that. So if you've had the AZ jab, for instance, that we know that from study after study, that the chances of you being infected are 65% less than they would be otherwise. With the Pfizer jab, it's about 80% less. So you're less likely to be infected. And if you are, you can only pass on the virus if you are infected, and that's why the vaccines are so important.
Yeah, but you've got a 37% chance of still passing on COVID-19 if you've got it, even if you've been double jabbed.
And, you know, this isn't about perfection. You know, there's no risk-free world
perfection,
that we can...
With all due respect, Health Secretary, come on.
We don't live in a risk-free world. This virus, we're learning about it all the time, and it's our duty to make sure that we're doing everything we can, using all the tools that we have to protect people. And what yesterday's announcement is about protecting some of the most vulnerable people in our society. That we already know, anyone who's in hospital, in a hospital bed, they're there because they're vulnerable. They're already ill. There's already something that's making them, you know, ill and vulnerable. And the last thing you want to do is expose them to this horrible virus if it can be prevented. Now, I'm not pretending, nobody is, that you can have a 100% method of protecting them, but what you can do is reduce the chances of them becoming affected. And I think it is perfectly reasonable to say to everyone that works in health and care that you please take this vaccine. Some 93% have had at least one shot, and that's fantastic to see. There's still around 100,000, we estimate, in the NHS that have not. But over the coming months, we will work with them, the NHS will work with them in the most positive, constructive way to help them make that positive decision to take the vaccine.
Yeah, 37% chance is still pretty high, though, isn't it? Would it not be better?
Well, what would you like, Kay? Would you like a 100% chance?
I was just about to go on, if I may.
37% chance. You say it's quite high, but I'll tell you what, 80 and 90% chance is a lot higher. And I think your viewers listening to this program would understand that this is about minimising the risk. It's about minimising the risk. With this virus, it's a horrid virus. Sadly, we know so many people that have been affected. You may know, I know people. I've lost loved ones to this, but lots of people have listening to this program. And I think what they would expect, that if you are in a vulnerable situation, if you're in a hospital bed, you're in a care home, you're at your home receiving domiciliary care, they don't want to know that care worker that is perhaps visiting some 10 people that day, if they are infected and perhaps they're asymptomatic, do you want them going around every house and infecting 10 of their people that they're seeing them? Of course you don't. Your viewers don't want to see that. Now, I'm not saying it can be 100%.
If I can jump in at some stage and say, I was going to go on to say, why not
you
test
can, but
people?
I'm only doing what you normally do, but carry on.
If I may, I was going to say, why not test somebody every day if they're a frontline worker and then you're 100% sure that they haven't got the virus?
We do that anyway. The NHS will do that in I don't know if it's exactly every day, but in the NHS and in care homes, people will be tested regularly precisely for the reason that you pointed out earlier, that when you take vaccines, of course, your chance of being infectious is a lot less, but it's not foolproof. And that's why having the vaccine alongside regular testing is the best way that we can go and protect everyone in any way that we can.
You test people twice a week, I believe, in the NHS. Why not test them every day?
I think that it's about regular testing, and I leave that up to the clinicians to decide
not every day,
how.
though, is it?
I think the clinicians should decide how often people need to be tested and the types of tests that are taken. But I think as long as there is regular testing and people have taken the vaccine, and of course there are other controls in place in a hospital, other infection controls and measures, I think all of these taken together makes the conditions for those vulnerable people as safe as they possibly can be. And again, that's really at the heart of yesterday's announcement. It's all about patient safety. Of course, it will help protect other colleagues in the NHS and in care as well, because you don't want the staff to get ill if that can be avoided. And so this is what yesterday's announcement is about.
OK, what has Geoffrey Cox done wrong?
Look, I don't want to get into any individual case, especially if I don't know the details, but I know obviously the big issue that you're talking about, and I do think it is important that any member of Parliament, if they do have any external duties, that they are completely open and transparent about that. I think it is important that their constituents obviously know about that, and also that they engage in no kind of lobbying whatsoever.
OK, Labour's referring Sir Geoffrey Cox to the Standards Committee for a brazen breach of the rules. Do you want to defend him this morning?
As I said, I'm not going to get into an individual case. I don't know the individual circumstances of every member of Parliament. All I can say about Geoffrey Cox in my time in government with him, when he was beside me as a cabinet minister, he was a fantastic cabinet minister. But in terms of these issues, I don't know the details.
OK, let me ask you more generally then. Do you feel comfortable with the rules as they presently stand on MPs having second jobs?
I think the rules as they currently are, in terms of having that flexibility, whether it's a consultancy type job, whether perhaps it's an MP that is still serving in some capacity as a doctor or a nurse, or I think it's a right that those rules allow that flexibility. But I think the most important thing really is that that MP, whoever he or she may be, is completely transparent and open, follows all the rules, and so that their constituents and the wider public know that they might have another interest. But also, I think it's important that they continue to spend the vast majority of their time on their parliamentary affairs and their constituency affairs. OK. Should
MPs be able to use their office for second job work?
No.
OK. So if they did, what should happen to them?
Well, look, you might be trying to draw me into some individual case, but if there are concerns, or
you said no, they shouldn't.
If someone believes for good reason that they might, then I think what they should do is ask the appropriate authorities to look into it, and they can get down to the facts.
Yeah,
but of course you shouldn't be using, whether it's your parliamentary office. Yeah, if it's your whether it's your parliamentary office or any other parliamentary stationery or anything that's funded or supported by the taxpayer, of course that should not be used. And again, I can't talk about any individual case. I think the rules on the use of whether it's parliamentary property or your letters or letterheads or stamps or anything like that, I think the rules are clear. And of course, all MPs would be expected to observe that at all times.
OK. I'm not talking about specific cases because you don't want to. But if somebody did use their office for a second job, what should happen to them?
Look, I don't know. It would depend on all the circumstances, and I'm not the judge of this, nor should I be. It should be independently judged by the Parliamentary Standards Commissioner. So if there are particular cases, then I would trust the Commissioner to look at that and come to the right decision.
OK, well, that's what Geoffrey Cox did, apparently, but you don't want to talk about specific cases. What I can talk to you about, though, is that the Vice-Chairman, Andrew Barry of the Conservative Party, has stepped down. He says he can't cope with all this sleaze anymore. It doesn't look great, does it, when that sort of thing happens?
Look, I don't know about that. You just shared that information with me. But I think, look, it's really important that parliamentarians, whichever party that they're in, there are really clear, transparent rules, whether it's around lobbying, it's the use of parliamentary property, and that they are held to the very highest of standards.
It's frustrating for you, though, I'm sure, isn't it, given that if last week the Prime Minister had not forced all of you to support his mate, who subsequently had to step down because the British public are just not having it anymore, then, you know, you wouldn't be in this position, would you, as a party?
There was a case, a particular case. In that case, it was the Owen Paterson case. And look, I voted for that motion. I do regret it because I think it was wrong for me to conflate the Owen Paterson case with the right of an appeal. I do think it's important for parliamentarians on a cross-party basis to think about how they might always be able to improve a system. But it was wrong to conflate it with Owen Paterson. So I regret having voted for that. I'm glad it's something that is settled now, as in I believe yesterday the government has brought forward a motion to rescind that and to accept the Owen Paterson report in full, and I think that's the right thing.
OK, final question before I let you go. Back to on topic for you. I'm reading in the newspaper this morning that over 65s in France will not be allowed access to restaurants, on trains, etc., unless they've had their booster. Is that something that you might look at?
We're not looking at that yet. You're very focused on our booster program, as you would imagine, over 10.6 million boosts, I think, throughout the UK so far already, a record number of bookings, many people coming forward. I think in due course, we will have to look at what constitutes vaccination. But at this point, the most important thing is that anyone that's eligible gets out there and gets their boost. OK, you said yet, so potentially in the future. I can't rule that out, and I think that we know now that the vaccines do wane, and it is important that those vaccines, where it's necessary, that those people get a top-up, and that's what the booster program is about. But I think it's something that we have to keep under review.